Why is my pet always itching and scratching? Dermatology disorders are among the most common health problems in dogs. On this episode of the Paw Report, we're joined by Dr. Stephanie Bruner to talk about the many skin issues that affect our pets. Stay with us.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Welcome back to the Paw Report. We are back on location at the University of Illinois, the Veterinary Teaching Hospital, to talk about all things allergies. Pretty common topic. And our special guest for this episode is Dr. Stephanie Bruner, a new guest to the Paw Report. And as we do for every episode with a new rock star guest on the Paw Report, we give you the floor to tell us about you and your journey to the University of Illinois.
Well, great, thank you. I'm actually very new to the University of Illinois as well. So I'm originally a Hoosier, attended Purdue University, got my veterinary degree there, and then I did 4 years in small animal general practice, so utmost respect for general practitioners. It's hard work. And then I went back to Purdue, because you can't get enough of Purdue, and did 4 more years there for my advanced training in dermatology. And I've been practicing specialty dermatology in a private practice in a hospital that my husband and I co-owned for about the last 25 years outside Cincinnati, Ohio. And then got the last kid into college and thought, what's the next chapter? And this is the next chapter for me. So I've been thrilled to be at Illinois for the last year. It's everything I wanted it to be, and I'm happy to be here.
Well, welcome to the University of Illinois and Illinois. And as you mentioned, your specialty is dermatology. Today we're talking all things allergies. It is a topic that is very personal for you. You're very passionate about it. And when we talk about allergies, we know that, allergies are common in humans. We get allergies. How common are they in our pets? And maybe just wheel it back a little bit. What is an allergy? We'll do the allergy. How common is it? Very common, actually. More common than I think most of us recognize, though, again, general practice veterinarians, it makes up a good bulk of their day. In terms of sick animal presentation, it always ranks number 1 or number 2 in terms of, skin infections or ear infections caused by allergy. So even if it's not directly, glaring, this is allergy, underneath the reason you're at the veterinarian, there probably is an allergy. And it is something that defines each individual species a little differently, though interestingly, dogs are extraordinarily close to children, especially when it comes to environmental allergies. So we define those allergies as things that we think there's a heritable component to them, and that it's our immune system overreacting to what the rest of the world thinks is fine. I did learn that coming to Illinois, that the rest of the world seems to think that the ragweed count here is okay, but it is not okay. Especially right now in the middle of summer.
Yeah, so you're never too old to learn these things. But it's about having an abnormal skin barrier that we inherited, and it lets too much stuff in. In humans, we let too much stuff in our lungs get into into our body and react to it. In dogs and cats, it tends to be skin. So different organ, but same outcome, allergies.
You mentioned in dogs, it looks very similar to human children, which leads me to my next question. How does it present itself? I mean, is it itching, scratching, smelling, redness, soreness?
Yes.
Just all the above.
All of the above. No, it's true. You know, in children, we talk, or in humans, basically, in general, if it's up here, you know, it's rhinitis, conjunctivitis, sinusitis, but we call that hay fever, right? And when it's down here, it can be a variant of asthma. And when it's on our skin, and especially our children's skin, it's rashy, it itches, and in some forms we call that eczema. But the technical term is atopic dermatitis, and atopic dermatitis in dogs is what we spend our time with. So it just happens that over 90% of allergies in dogs are manifested as that atopic dermatitis. So we don't use the term eczema in our dog and cat patients, but if you start to think about them in parallel, it really starts to make sense. So in my allergic dogs, I talk to patients about what I'm looking for when I'm hearing them talk about their trials and tribulations at home. Dogs that may not be young, but had a relatively young adult onset. So they started doing things like, ooh, he licks his paws way too much, he thinks he's a cat. You know, ooh, he's having ear infections too often. More than 1 or 2 a year is not normal. Too many skin infections. More than 1 or 2 a year is not normal. I don't get ear infections 1 or 2 times a year. Why should your pet? And then we start to think about behaviors, and these are the real giveaways. I call those my big 5 dogs. They're head shakers, face rubbers, foot lickers, belly scratchers, and bottom scooters. And it's kind of interesting. Clients, you know, you can just sort of see them keeping count. And they'll say, oh, we're at 4 out of 5. And I'm like, 80%, that's a B plus at the University of Illinois. Actually, it's a B, but but I'm like, you know, you're getting a report card. And you don't have to have all those behaviors. You have to do just 1 or 2 of those things too much. And that's a pathology. And a pathology has a diagnosis. And many times that diagnosis in dogs is an allergy of some sort, whether it's fleas or food or the environment, or very less often medications and chemicals. But most of the times it's fleas, foods, and environment. And in cats, it manifests a little differently. Some cats rip their hair out. Some cats groom their hair out. Some cats develop rashes and crusting. Some cats grab their heads and want to just tear their little ears off. It has different presentations in different species, which is kind of what keeps it a little bit challenging. But we kind of look at you like, oh, you're a dog, now tell me about yourself. And then pretty soon they write their own story.
You know, you were talking about diagnosis. Can you put a number or a face on the dog and cat population and just what percentage are affected by some sort of allergy?
Yeah, so the numbers are all over the place because it kind of depends on where you live in the world. In Illinois, saying you have a pet with an allergy is kind of like telling me you drive your car. And I see a very specific caseload, right? Like I have a very different view of the world than I did when I was a general practitioner. I like to look at it as if you open a map, and there actually is one on the internet. If you go to the American College of Veterinary Dermatology, acvd.org, it'll tell you where to find a dermatologist in your area. But that, interestingly, we go where the work is, right? And so, you know, there are 3 here at the University of Illinois. There's a handful up in Chicago. There's a handful in St. Louis. There's a handful in Indianapolis. What does that tell you about us? Do you know how many there are in Montana? 0.
Right.
And so that it really does give us a reference point. Around in this area in general, on a global area, they'll talk about maybe only 2 to 5%. But in this part of the world, it can be as high as 10 to 20.
If we could step back again, and maybe if you could hit on the causes of allergies. I know we talked about environmental,
Sure.
Maybe a little deeper into that, and some other, you know, reasonings people are headed to your office.
Yeah. So statistically, just across the board, fleas are number 1. I don't personally see flea allergy that often because thankfully we have a really good primary care veterinary base in this area, and the pets we see come in and they're getting flea prevention, they're getting tick prevention, they're getting heartworm prevention, so that's great. And those patients are easily, not necessarily resolved. I can't say, stop itching when a flea bites you, but we can say just don't let fleas get on your pet and it's going to be fine. And so that one's a more preventable type allergy, and it's one of the few we have. The next in this part of the world that statistically is most likely are the dogs I see, and those are the dogs that do have environmental allergies. And when we say environmental, generally speaking, we're talking about the pollens, the weeds, the trees, the grasses, all of which are the perfect trifecta that's happening right now. There's a little tree left over, the weeds are coming on, and the grasses are really going crazy. So everybody who walks outside right now is just sort of getting bombarded with pollen. And then for my little friends who just go year round, or for indoor kitties, and sometimes indoor doggies, it's house dust mites, right? And not house dust. And I always caution people because it's offensive to say your house is really dusty and your pet is sneezing a lot. But basically, we'll talk about house dust mites, which everybody has. If you own a sofa, if you own a mattress, if you have a nice rug, you have some house dust mites. And it's not that you have more, it's that your little precious angel is living at your house and would be just as miserable at my house. So we talk about what can we do with that. But certainly if you're allergic to house dust mites, there is no season for that, right? You live indoors, it's 365, you don't get to catch a break. So those are what we think about when we talk about environmental things. And then food. Food is interesting, and food is tricky because dogs and how they react, and cats and how we react to diet, and what diets in terms of how our immune response is really not the same as people. And that's really unfortunate because most of the laboratory tests that are out there, there are blood tests and skin tests, and there's a hair test and a saliva test to do. But we have to keep in mind currently, and I think that'll change in the future, but currently all those tests have been on the basis of if your dog was your child. And I have 3 French bulldogs. They are my children, and I hope my children aren't hearing this.
They'll see it.
They'll see it.
Yeah.
So kids love you too, but the idea is, they are my children, but they're not human. And so those tests aren't valid. So we encourage people, don't do those tests. Come, let's talk about how can we root out what foods are bothering your patient and what foods are not. And it's not that they can't eat normal food again. It's just, if it hurts when you smile, don't smile. And if you itch when you eat chicken, don't eat chicken.
Okay, so role play here. I'm that client and you're like, well, does your dog shake its head? Does your dog itch profusely, lick their paws? And I had 4 of the 5 that you mentioned.
Yeah.
Okay, so how is Fido treated?
Yeah.
Or what's the process of getting those tests done and then deciding a treatment option plan?
No, it's great. History is everything. So owners that come loaded with lots and lots of information, they're fabulous for us because we can a lot of times check a lot of boxes just and say, great, you observed that, so now we don't have to worry. Or you are using flea products. So we can typically eliminate things quite well. And the idea is we'll work our way through, let's make sure it is allergy, and then once we're confident that it's allergy, because that's a clinical diagnosis, we don't have to run super special tests to say, oh, I think you have allergies. I think you have allergies. The question is, what can we do about that? And we talk about, is he licking or is he more inflamed? Or is he both? And how is his skin quality? Does he have a good skin barrier? Could we improve on that? That's a different type of therapy than it is with, once it gets in his system, his immune system's really just going crazy. And that's important. A lot of our clients feel that there's something wrong with their pet's immune system in terms of them being deficient. And these pets are not immune deficient. Because I'm an allergy patient myself, I tell them that we are actually we're very, very successful. We're your A+ responders.
Yes.
And so we just have to tone that down a little bit and kind of fall back into line for what is normal. But we don't have deficient immune systems. And these pets aren't getting infections because their immune system is deficient. They're overly sensitive and things are just a little out of control.
So if I wait, it'll get better, the itching will stop. You know, if I wait, prolong getting my pet checked for allergies, could it spawn other health problems?
Yeah, and that's a great question. It is a domino effect. It is always a domino effect. And so that first domino is you have an allergic patient. And then the next question is the allergy going to bother you, right? I don't have problems all the time. I just don't like ragweed season. And so I'm fine most of the year. Some of our pets are that way, and that's great. But many of them do eventually add things to their little pollen list where you're just like, now it's just over and I can't catch a break. So when that first domino falls over and that allergy reaction is triggered, the next thing that happens in these patients is their skin becomes inflamed. And we see that, right? People say, I think he has a fever, I touch him, he's warm. But he doesn't have a core body temperature increase, so he doesn't have a fever. His skin's on fire, and we can feel that. So the skin's inflamed, it's hot, it's itchy. How does our pet respond and react to that? They rub, they scratch, they roll, they traumatize their skin. And now we've got this moist, hot, beautifully humid environment. It's basically Illinois in the summer. And the idea is with traumatized skin, normal bacteria and normal yeast organisms that live on the surface are in paradise. It's a jungle out there. So they're able to overpopulate, they overwhelm the skin's local immune system, and now we have an infection. A bacterial infection on the skin or in the ears, a yeast infection on the skin or the ears, but now you don't really have one problem, you have two. And if we only treat the allergy, but we don't treat the itchy skin infection, no perceived improvement, right? And if we only treat the infection, but we don't set up all the dominoes and go back to the first domino and make sure it's upright, no improvement. So our job is to pretty much identify all the dominoes, set all the dominoes back up again, and then try really hard to make that first allergy domino as absolutely difficult to tip over as humanly possible. Because I inherited this, thanks Mom, it's not curable. Right?
That was my next question.
Well, no.
Magic question.
No,
Is any of this, allergy curable?
No, not so far, but we're working on it. We're working on it. We have things we're working on, but we have good medications, and the idea is some medications for some patients are just going to work better at keeping that domino in an upright position, way better than any others. And that's our goal, is to find your best domino glue.
You mentioned medications, but anything I can do in my home, any home remedies that we can do as well?
Things. Yeah, lots of things. You know, one, water is wonderful, right? Many uses, but just getting your pet wet. You can shampoo, and that's great, but sometimes my pets just love running through the garden hose, and believe it or not, that's therapy, because the pollen gets into their system by being soaked into their skin through that abnormal barrier. So highlighting and hydrating that barrier. But you know, I have little dogs, and they're basically Swiffers on feet. And the idea is if I can just wash off my Swiffer
out.
Yeah. But if I can just knock the pollen off my little Swiffer, then any pollen I take off the pet before it has a chance to soak in is a day ahead, right? Close observation for those infections, aggressive early treatment, just usually with topicals. We catch them early, they don't need antibiotics. They just need an antibacterial shampoo. And in the home, you know, it's hard, but if we think it's house dust mites, washing their bedding at least once a week. It's not the chemicals, we don't want to use heavy chemicals, just hot water kills house dust mites. If it's too big a bed to put in the washer and dryer, park it out in the sun and roast them for an hour. Flip it over and roast them for another hour. But just things easy enough. Grandma knew what she was doing when she line dried our laundry.
Yeah.
And we don't do it anymore, but it has medical benefit.
Is there truly a hypoallergenic dog out there?
No. There are some dogs that shed less or have less scale, but ultimately the allergen is a component or a protein and something found in their skin cells. So if they have skin, they can potentially be allergic.
That leads me to my next question are there certain breeds that are more prone to having allergies? I know you said
Absolutely.
Oh, really?
Yeah, absolutely. We definitely see it in certain lines. The problem is that they're all lovely dogs and they're all very popular groups, right? Golden retrievers, Labrador retrievers. French bulldogs are hugely rising, and I'm crazy enough to have 3 of them because their benefits offset. Now, do I breed them? No, they're adorable, but the world doesn't need 2,000 more French bulldogs. Mine are rescues, and they all came to me by virtue of the fact that they have health issues. But French bulldogs, golden retrievers, spaniels, shih tzus, all the ones we love, they're pretty high up on the list.
So in our last couple of minutes, if you have to really hit home something to pet owners that are watching out there, maybe somebody's thinking about getting a pet, maybe somebody that has a pet that's concerned that they have allergies, put a bow on our discussion today, and what's the best advice that you can give to them?
Yeah, just watch your pet carefully and have that conversation with your veterinarian early. Get them while there's just one domino. You know, if they're just licking their feet too much or having an ear infection a little more often than you think, dive in, take that deeper dive into why is this happening. You know, we all have bacteria on our skin, but I didn't wake up this morning looking like that. I can manage mine. Your pet cannot. So let's talk about why that is and correct that problem so the dominoes don't keep falling down.
Deeper dive here at the University of Illinois. I know that there's some clinical trials going on involving different allergy studies. Can you tell us about those?
Yeah, so one of the ones we're doing right now is a post-marketing study. So the drug is already out there, but it's very, very new. And of course, how things look on paper when they're presented to the FDA or on the label don't always look the same in real life circumstances. So we're currently enrolling real life allergy patients who have not had great luck with some of the other standard fare that's out there and are willing to give us some feedback on how a new product might work for them in the home in a real life situation. So if you're in that category, give us a call or talk to your veterinarian about referring you, and we'd be happy to take a look.
How long do those studies normally last before you have the aha moment that it's working or it will work or won't work?
If there's major side effects, they don't last very long at all. We immediately cap it. The one we're using right now, we're really liking the outcome. So this one is capped based on number, and we'll keep going until we have the appropriate amount of dogs to make a statistical difference so we can publish this and say, look, it wasn't just 3 dogs or 4 dogs. We looked at a lot of dogs, and this is a really positive trend. So we would cap it early if there's problems, but we're going to carry it through to the end until we get our number. And Insider is looking pretty good.
Excellent. Great way to end this segment of the Paw Report. Dr. Stephanie Bruner, a rock star. You hit it out of the fence, I guess we could say, on this episode. Thank you so much for joining us, providing us lots of insight on allergies. So hopefully it will encourage pet owners out there to maybe have their dogs and cats checked, just in case.
Great. Thank you very much.
You bet. And thank you, our viewers of the Paw Report, for joining us for this episode on the road at the University of Illinois, the Veterinary Teaching Hospital. Until next time, I'm your host, Kelly Goodwin. We'll see you then. If you're a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.